So this is on how to build a budget. I have to say, I actually always enjoy writing my budget. And then I got to the US and then I really didn't enjoy writing my budget, but I had a lot of insight into what went into the budget and what is simpler for you in Canada and what is a lot more complex. But I actually think these are really good things to think about. And I'm going to talk to you about how you can talk to US colleagues in a way that will make sense and why there's some challenges between cross-border collaborations. So, whoops, there we go. Ooh, there we go. I'm actually, to talk about a budget, first we need to talk about a timeline. So in the learning objectives, I'm going to talk to you about how to build a timeline and what are the purposes of a timeline, why they're so important, and how you use your timeline to develop your budget. And I'm also going to go into, the reason I'm going to go into direct and indirect costs, even though in the Canadian context it's a little less relevant, is that when you get outside of CIHR funding or NSERC or SHRC, this actually becomes really important and can sink your project. So I'm going to talk a little bit about what are indirect and direct costs. And then I'm going to go over some things of the basic elements of a grant budget and how you detail it and how you describe it. Typically in a review, a peer review of your project, they wait until the end after the scientific merit to discuss your budget. But in the US now, what they've started doing is discussing the budget at the same time, with the thinking, rightly so, that if it's not sufficiently funded, that's actually a fatal flaw in your project. So while in Canada, they're currently considered separately, Canada does tend to follow the NIH in their trends. So I think that that is going to change. But also realistically, I have seen instances where people are like, this makes no sense. They can't do it on this budget. And the funding agency might actually pull your application out and say you didn't meet the requirements because of your budget. So the budget's still really important. And if you're successful, which is great, congratulations. If you have under budgeted, nothing quite like not being able to deliver on your outcomes. So under budgeting is not something you should be doing. And I know a fair few, both new and experienced investigators are like, I did not account for that. And a really good example of that most people fail to account for, patient and partner participation compensation. So you said you're doing an engaged grant, but you have no money for it. People are like, well, are they really? Because you're supposed to, compensate your patient partners. So we'll get into all those sorts of details and find out all the fun stuff that goes into budgets. So I'm going to quote some men that I don't necessarily respect, but I actually love quotes. So I'm going to use the quotes anyways. Winston Churchill said, "Those who plan do better than those who do not plan, even though they rarely stick to their plan." This is so relevant for research. You're going to have a fantastic timeline, plans, and something, IRB, pandemic, electricity failure is going to mess with your plans. So, but still plan, and then have a backup plan. So let's talk about a plan, which is in research speak is a timeline. A timeline is your plan. Okay, so this is your plan of attack. You need a timeline. It is an overview of how the project is expected to progress over a very specific time period. So typically you're applying for a grant. It's for like 1 year, 2 years, 3 years. It used to be 5 years, which was a lot more generous, but now it tends to be a tighter timeline. So in that time period, what are you really specifically going to do to achieve your scientific objectives? And a timeline is made up of a series of tasks and milestones that are attached to time periods or dates. I suggest you do both in case, there's a delay in when you receive funding. I just want to clarify that tasks are something a piece of work you're expecting to do or being undertaken. Milestones, because oftentimes you have, I'll show you examples, but you'll have tasks and milestones. Milestones are things you expect to achieve by a certain time, and they're an event marking a significant change. An example is you complete recruitment. Okay, that's where you've got everybody in your study. Now you expect to actually do the data collection or the interviews or whatever you're doing. So these definitions are important. Again, you'll have these slides to refer to. I will share them with you so that you don't actually have to listen to me do the whole talk to figure out these little references. Oops, I went the wrong way. There we go. Why am I talking about timelines? Timelines are so important. After you write your protocol or while you're writing your protocol, start detailing a timeline, okay? And what does this do for you? When you put down a timeline, like what do I expect to have done by when? What it does is sometimes it identifies missing information in your methods section. Like there might be things about your patient population you haven't included, or there might be a process that you haven't talked about in your methods. Missing details in your methods are one of the things that sink a grant. When you're new at writing grants, what we tend to be all really not necessarily good at, but really familiar and comfortable with is the background. That's great. You wanna, that's your hook, your like hook to get people interested and tell them, yeah, this is important, pay attention. The meat of your grant is your methods. Missing details, unclear, will sink your grant every time. So the timeline just helps you make sure you're not missing anything in your methods. It details the project deliverables, like when are you going to do what? So much as the way a protocol is a recipe, this is like what you're expecting to have happen when, right? And if it doesn't happen, do you have plans for that? It helps you plan resources, both human and time. So I'm going to come back to what goes into your budget, but a timeline says like, okay, do you need an RA to recruit? Like how long are you planning to recruit for? How many people do you expect to recruit every month to reach your targets? If you're doing primary data collection, that tells you, this is why it links to budget. That tells you, you need an RA for 6 months at half-time or full-time to meet your recruitment targets. So it really helps you plan a detailed and yearly budget, because you're like, well, if I need to achieve this by that time, what help do I need and resources do I need? And what do I have to have bought or paid for or done by that date? Okay. It also demonstrates feasibility. If you say in your sample size, I need 2,000 people, and you're saying I'm going to recruit 20 a month, I'll let you do the math. I teach statistics, not math, but I'm just telling you right now that timeline's not going to work. So it really helps you decide, like, are there enough people seen in enough clinics to make my recruitment feasible? Or is the time that I need to get the secondary data released to me and pass IRB, if that takes 2 years and you're in a 1-year project, it's not feasible. So these are all the things that the timeline does for you. Here are essential elements to put into your timeline. When and how long do you expect it to take to get ethics approval? How long do you think it's going to take you to recruit everybody you need into your study or get access to your data or whatever it might be? How long is it going to take you to do data collection if it's primary data? If it's not primary data, you still need to account for data management. Nobody gets a clean data set, so you need to account for that. Data collection. Are you doing interviews? Are you doing surveys? Please tell me you're not doing surveys. But if you're doing interviews, what are you doing? How are you collecting your data? How long is it going to take you to schedule that? Okay, and how are you doing that? Then data analysis. Please don't underestimate this step. If you are not a biostatistician and you do not have a biostatistician on your team, you need to add time, extra time in to do this, because it's going to take you a lot of time to do this, even though you have the details in your methods. it still takes time to do the data analysis and then figure out what that means. Then you've got writing and dissemination. And while a very good detailed protocol advances that process, you still have to map this out. You've got co-authors you need to take into account, and you have reporting and all sorts of different things. So these are essential items that you should say, what's a start date and end date for each of these steps? And it needs to be reasonable, and experienced researchers will know that if you put in 1 week for ethics approval, that you potentially don't know what you're doing and have never done research, because that never takes that short a period of time. Here's optional elements that you might want to put into your timeline to flesh it out, depending on how your protocol is written. Partner or planning meetings. If you have a lot of other people involved in the research, you might want to have annual meetings, quarterly meetings. How often do you need to meet to move this ahead? Research Oversight Advisory Committee meetings. Some funding agencies, like Genome Canada, require you to have an annual oversight committee meeting. And so, you have to put those into your timeline, like, okay, at the end of year 1, we're going to have this meeting, and this is who's going to be invited, and this is how it's going to be run. Budget implications. We're in a virtual world now, but before the virtual world, you had to pay for people to come to your oversight committee. Critical reviews or synthesis of literature. There might be some things you need to do if you're co-developing questions, or extra things you need to do. Knowledge translation plans or activities. We now, in the States, this is implementation science. Like, how are you going to get the results to have an impact? So one thing I always point out to people that are doing research, everyone that does research, short of having a nervous breakdown and moving to Tahiti, gets results. You get results. Very few people have an impact. So you need to think about how you go from results, like, here's what I found, to this is how it's going to make a difference, or these are the people that need to know this, and this is how I'm going to communicate it to them. Scientific publications are really important because that details what you've done. It allows other people to build off of what you've done and go on to next steps of research. That is not knowledge translation. That's telling your peers what you've done so they can continue the research continuum or research evidence generation. Knowledge translation or dissemination or implementation is making a difference in people's lives with the information you've generated. So you need to think about how that is more and more important, because the funders want to know what impact you're having and what's happening with their research dollars you're spending. And decision maker, policymaker meetings. So if you're lucky enough to work with policy people, like, how are you going to meet with them? How are you going to communicate with them? There are several formats of timelines, and actually each of these formats are very, very helpful tools to actually run your research. One is a graphic representation. Some of this, whether you include this in your, I suggest you do all 3 formats. What you include in the grant will depend on space, allocation, and requirements of the funding agency. There's a graphic representation, there's a tabular format, and the infamous Gantt chart. If this is the first time you've heard the word Gantt chart, you're so fortunate. That's not going to last. You, at some point in your research career, are going to have to deal with Gantt charts. Genome Canada and the Public Health Agency of Canada love Gantt charts. So Gantt charts are actually really useful for certain things. And I'll go over that now. This is a tabular example of a timeline. You can see the activity. Okay, and by the way, all these examples are from my research. So I actually had to create these and live by them, live and die by them, literally. So, I have an activity, I have a start date and an end date. And you'll see here that I started the ethics approval before I expected to get funding. And a lot of IRBs will allow you to submit your protocol for funding, and they have a question saying, have you got your funding? Are you going to do this anyways? So you have to talk to your IRB, but if you can start it in advance, I strongly recommend you do that. So then you can see all these different, these were a mixture. These are mostly tasks, not so much milestones. And I've got a start date and an end date for all of them. This is what it looks like to do it in a graphic form. This is really helpful to when you've got a multi-year study with big. So what I've got here are milestones. So in year one, what did we expect to achieve? In year two, oh, nice. I just noticed my typo. So let's call year 2 1 and the first year 3 2. So what did I expect to achieve in the first year? What did I expect to achieve in the big milestone for year 2? What's the big milestone for year 3 and the big milestone for year 4? This graphic timeline was because I had different participants for each year. So this was a very nice way to demonstrate how I intended to build the project over the 4 years. This is a Gantt style graphic timeline. I'm going to show you a Gantt chart. What's nice about this is you see the green arrow. I was able, as I presented to our research oversight committee, this is what we said to Genome Canada we would do. And I was able to move that green arrow along based on where I was with the project. So, and it shows quickly, it very clearly shows how certain activities overlapped with other activities. So when you have activities that are ongoing, so when you have a multi-phase trial or things like that, this is a really nice way to clearly demonstrate to the reviewers and the funding agencies how those work and how you plan to do that. Oops. This is a Gantt chart. Okay, you see it's broken down by quarters. So you have to define what is Q1 for your project, what's the first quarter. And we have start dates and end dates, and then you have all the activities, and the gray boxes are the time periods you expect those activities to occur. The nice thing about Gantt charts is it allows you to work with multiple projects and different people and track where are you at. You know, so by this date, you should have done that activity. Gantt charts are really useful for project management. And to be honest, when you're a researcher, you're a project manager. When you're the PI, you're the project manager of your project. So there are adaptations to your timeline when you have multi-phase projects or mixed methods designs. It's very good to have that clearly delineated. Multi-stage recruitment. In the one project I used for all those examples was a Genome Canada implementation, the GELS part of the Genome Canada, where I was engaging with clinicians, then I was engaging with parents, then I was supposed to be engaging with children, but I had to come up with a completely different data collection method. So, and then I went back to the healthcare professionals. So the other thing to be aware of with these timelines, pay very, very close attention to the reporting requirements of the funding agency. There's some funding agencies where you create your timeline and your budget, and there is no room for deviation. You have to have written approval for deviation of what you put down there. Thankfully, CIHR is not one of those agencies. Public Health Agency of Canada and Genome Canada are. You literally have no flexibility from what you said you were going to do. And you may also have embedded projects. So a couple of timeline do's and don'ts. Do start it when you expect to get the funds. Don't start it with when you submit your grant application or the grant application deadline. There can be anywhere from 6 months to a year's different. So keep that in mind, like, when am I going to start this project? Absolutely include major milestones, but don't get so in the weeds. You can create something for yourself, a Gantt chart or a tabular that is super detailed. What you put in the grant should be one level up so that people don't get lost in the weeds. One of the tricks to the timeline, make sure the research questions or your aims or your objectives map to the milestones. Okay, that's really critical. Don't include milestones for activities not included in the grant. When you write a grant, you're going to generate data. You might have master's students, PhD students, residents, medical students that are going to do all these little side projects. Don't put that in your timeline. Your timeline is for that protocol. Okay, you do hope that the data can be used for something bigger than that protocol, but that's not things to put in your timeline. I recommend that you start with a detailed table, summarize it graphically for big picture, and then decide which one you're going to put in your grant or both. Use the Gantt charts for project management and budget planning. The Gantt charts are visually a great way to see if your budget numbers line up by quarters and years, and ensure that timeline maps to the research question and methods. So when you put out all your tasks and milestones, just go back and check if you talked about all those things in your methods. So that is the timelines. I'm going to stop there for a second because now I'm going to talk to you about budgets. But the timeline, you can't, it's almost impossible to build a budget without a timeline because you just don't know what the tasks are that you're funding. Any questions before I?
Just a couple comments, Gillian. First of all, I think this is great that you've connected the timeline to the budget. I think that's really critical. The pieces around presenting the timeline, I think, are also valuable because I can see in tabular format, there's certain advantages where you can put more detail. Gantt chart, of course, you can see the big picture and you can see the overlap. So I think that's extremely valuable. And then I guess the next comment is, or really a question, did George Bush really say this?
Yeah. As one of my colleagues said before, she was about to give a Teddy Roosevelt quote. She's like, it's been a long time since I quoted a Republican. I can say it's been a long time since I've quoted a Republican, and oops, where's my? I was like, do I keep this in here? And then I'm like, you know what? Irony is not dead yet. It's clearly a budget. It's got a lot of numbers in it. I couldn't resist. I'm just gonna, okay, thank you, Cleo. He likes my practical do's and don'ts. I do try and be very, I do try and be very practical and pragmatic. Okay, so we won't dwell on George W, as they call him here. If you take his approach, it's not going to end well for you. So let's talk about how to really do a budget. I'm going to talk about two things, even though we are in the Canadian context. So one of the things you need to realize is that for probably 90% of the budgets you write, you will only ever include direct costs. So what are direct costs? They are specifically and easily identified as costs for a particular project or activity and are allowable under the granting agency guidelines. So this is important because it was interesting that with COVID, a lot of times, for example, you could not include Wi-Fi or cell phone costs or certain softwares or certain hardware in your grant. And then they had to change that because suddenly that's how you access your participants. So you have to pay attention to what is allowed in your grant. A lot of grants won't allow computer equipment, which is like, well, okay, where am I supposed to get that? So those are the direct costs, the things you need to be able to do that project. Indirect costs are really important, but oftentimes in Canada, you are protected from the calculation of indirect costs, and I'll tell you why in a second. That's your overhead expenses, okay? That's your salary, the benefits paid to you, the building you're in, if there's any admin, Sylvie and Maddie, those are indirect costs. And when you think about indirect costs, it's everything you need to do your research, but not necessarily associated to a specific project. There are things everyday things, it's the desk you sit at, the office space you have, and all of this has gotten a bit tossed in the air with the pandemic, right? Because now it's like, yeah, but I'm sitting in my home, I'm using my home electricity, I'm using my home Wi-Fi. I need a laptop, not a desktop. You know, I need a computer that has a camera and a good mic. You know, so suddenly these things are changing a little bit. But why you need to be aware of this is in council, in Canada, the Tri-Council, which is CIHR, NSERC, and SHRC, have an agreement with all the educational institutes that says, instead of having the researcher put these in there for every, you know, like a billion different projects, we're going to negotiate that we send you those directly, and you as an institution decide what happens to them. So that creates an interesting dynamic at different universities in how that money gets spent and where it gets spent and everything else. In the US, you put those things in your grant. So then the money comes back and a certain amount goes off to the university, and then they negotiate agreements between the School of Medicine and the department and the researcher. And it's very complicated, very complicated. So oftentimes you will have personnel that can help you with this. You do in Canadian universities have offices of research funds, because they're the ones that have to make sure everybody abides by the rules. And they are often very aware of what can and can't go in budgets, like really random stuff like a postdoc fellow's health benefits. They'll know that stuff. So the reason I'm talking to you about indirect costs is if ever you get into a non-Tri-Council fund, you need to include these. And that then depends on the university, and they can be really huge amounts. I know that for contracts at McGill, the salary, the indirects on salary costs for RAs and that are something like 60%. So that's where you need to start looking when you look at foundations and different things, like, are indirect costs accounted for? If not, like that 50,000, does that have to include indirects? Because you're going to find out you have very little money to work with in direct costs if that's the case. How much do they allow for indirects, and does that match what your institution would require? So for the purposes of CHR, you only need to pay attention to the top half of this page. You need to know the bottom half for everything else. Okay, so just keep that in mind. This is why sometimes foundation granting can get very complicated, or contracts or anything like that. So direct costs related to the project, they have to be allowable, reasonable, detailed, and justified, and they have to fall within a maximum funding envelope allocated to the specific granting opportunity. What's the total amount allowed for that grant? Not everything has a maximum, but most of them do. Like often they'll be like, oh, we're going to do catalyst grants for 100,000 for 1 year. So your budget can't go beyond 100,000. Indirect costs are usually a percentage based on direct cost totals. They're determined by the institution and they depend on the grant. That's where you need to go see your Office of Sponsored Research to figure that out. And I can say, like I said at the bottom, Tri-Council grants don't have indirect costs. Other grants absolutely do. And it often comes as a big shock to researchers because they're spoiled by this Tri-Council agreement. Okay, direct costs, personnel. So there's a bunch of different direct costs. This is a big chunk usually of direct costs that you put in your budget. So this can be research assistants. You need to check at your institution, are they unionized? Are there set rates? What are the benefits you have to pay? how long you plan to have them, how many hours, can you do casual, permanent, full, what is it? Trainees, typically there's set stipends for that. Consultants, these can be experts that are not faculty, so at your institution or other institutions. And then senior key personnel. Now, senior key personnel in Canadian budgets with a tri-council, you can't put their salary in. They cannot act as consultants. But you still need to account for their hours in the allocation of resources, okay? If you're ever participating in a US grant, these are, they are included in the grant, and NIH does something super weird called a salary cap. So it doesn't matter what my actual salary is, based on being a tenured full professor, they'll only pay so much. And it's anyways, I don't need to go into what a super weird system it is. Just put it this way, it adds extra work to my day to get this figured out and sorted out. Hours. So when you say, okay, I'm going to need an RA with this skill set, and you use your skill set to justify the amount you're paying them, you then have to say, do I need them full time? Do I need them 1 day a week? Like, do I only need them for 2 weeks? So you have to then calculate either the total number of hours you need them, or how many parts of the week you need them, which is a full-time equivalent. So 2.5 days is 0.5 FTE, right? So this is how you have to calculate how many hours do you need and how much it's going to cost you. Your hourly rates will be based either on published salary or salary caps, and you absolutely need to include benefits, which, depending on how you hire the person and on the rules in your institution, can be anywhere from 0.4%, which is a casual, no benefits position. Some places it's up to 65%. Okay, so you really need to know this. You need to know what the benefits are. What I tend to do is figure out what the maximum benefits are and add that onto the salary regardless. So if I do manage to hire them a casual RA, great. But if somebody then says, hey, I've got so-and-so and I need like 0.5 FTE of their salary covered, but they are a permanent position, I need to make sure I've got the benefits portion covered. Okay. Benefits is one of the things that trips people up on calculating their personnel and their RAs. Okay. Other direct costs. So the personnel are a big thing. These are other big buckets that tend to be in your budget: materials and supplies, equipment, facilities. This is extra facilities. Like, say you need to rent a meeting room. This isn't your office. This is extra stuff you might need to run your project. Travel, this is if you want to go to a conference, or if people need to travel to you for data collection, or you need to travel to them. You need to put that in there. Materials and supplies and services are often confused by people. So materials and supplies are things you're going to use up and they're done when you're done your project. Services are things that are ongoing that you would pay for while you use them. It's things like phones, Wi-Fi, advertisement and recruitment costs, membership or professional fees, participant costs, open access fees for articles. Please budget that. They're expensive. You do not want to pay this yourself. Plus, open access is now a requirement for most CIHR grants. So these are the big buckets of things. Equipment are like solid items that you don't dispose of afterwards. So it's computers, it could be special printers, recording equipment. I'm trying to think of other equipment. Yeah, so those are all things you need to keep in mind. Travel, travel and services, something people often forget about. Say you've got something where you're having people come to your center to like complete an interview or a test or something like that. Parking. Don't know about you, but in Montreal, that is $20 right there for like nothing parking. So you need to think about how you're going to compensate people for that and their time. Participant costs, that if you have patient partners, that's one thing you need to compensate. If you have people that are coming, you need to think about, if you're trying to get young, healthy adults, when are they going to come and see you? And do you need to provide daycare? Because if it's in the evenings when they're not working, they got kids. So what's going to happen with the kids? Or are you going to provide them with food? Or how are you going to do this? Think about people's context. This is actually why having patient partners or community partners on your grant is super helpful. They can really help inform you about barriers and ways to overcome them for participant recruitment. They're living that life, right? So they're going to be like, no, I can't come in the middle of the day because I'm working and I'm not going to get paid time off, and it takes an hour to get there by public transportation. So you're going to pay taxi fees? Like, how are you going to do that? When are you going to have them come? These are all really critical direct costs to anticipate. So you can see how you need to, how your participant costs might all come during the recruitment phase, or is it during the data collection phase? So that gives you the timeline and your numbers to figure out these budget items. One thing, strongly recommend you put your budget in Excel spreadsheet so that if you need to increase or decrease numbers, you can see what happens to your total there and your total at the bottom. If you do not know how to use an Excel spreadsheet and formulas, take a YouTube tutorial and figure it out. This is not something you should be doing in Microsoft Word. This is not something you should be doing on a piece of paper. Figure out how to do formulas in Excel. It literally takes 10 minutes on YouTube to figure this out. This is going to save you massive amounts of problems, because when you have a maximum budget funding envelope, what you're going to do is tweak all those little numbers. And if you then have to re-add them by hand, it's going to take you a really, really, really long time. So you've got your budget kind of figured out. Now, this is an iterative process. You can draft out a budget, and then you need to justify it. So for every line you have in your Excel spreadsheet, I'm not going to talk to you if you have a Word document. Every line you have in your Excel spreadsheet, you need to describe the purpose of that cost and how it was calculated. So if you have $20,000 for patient compensation, you need to say that based on the sample size calculation of X, I need this many patients. They're going to be here for this many hours. I'm paying each patient X amount of money based on these guidelines, and that then adds up to this number. That's the level of detail you need in your sample size justification. You need to say, you need to make it clear everything you're spending, why that's necessary, and why it costs that much. So if you're living in Montreal, you need to say the parking at any of the major hospitals is $20 after 3 hours or after 2 hours, with a maximum of $20 per day. So we're just gonna $20 for them to get here if they drive their own car, if they take a taxi. Average transit time for where we're expecting people to come from is X amount. That costs this. These are the level of details you need. But then you need to think about this. Otherwise, you're going to have a cost come up that you're not anticipating, and it's not going to be fun. So when you're doing this, I gave you some big buckets in your budget. That's linked to the typical budget format for CIHR. What I suggest you do is you put everything, you figure out what you need in a detailed Excel spreadsheet, then move them into the buckets, and then make sure it lines up with your timeline. So you've got like these different ways to make sure you haven't missed something, and your tasks. If you're putting in ethics approval, are you doing that yourself? Are you going to compile that, like the, 82 different forms, or are you fortunate enough to have an RA? If you have an RA, put their time that they're going to need to compile all those different things in there. So the data analysis, who's doing that? Is that you? Is that somebody else? Do you have the expertise to do it? Are you going to need to consult a biostatistician? Biostatisticians, by the way, are one of the people that you can list as a consultant. As long as they're not named on the grant, you can pay them as a consultant to do your work. They're named on the grant, they got to do the work for free. But they'll often want to do things like, so the other thing, what they'll want to do, and what you need to talk to your collaborators about is, okay, if you're lucky enough to have a biostatistician named on your grant, do they need money for a data analyst? So somebody that does like all the data cleaning and everything else, and how much time do they need for that? Your other collaborators, if you have people on your grant and they have no budget items, you're not going to have super happy collaborators. It's really tempting to say, oh, this is all going for here. But when you have an item, a line item allocated to a collaborator, it makes them a far more meaningful collaborator. Otherwise, it's just sort of people lending their name to your grant. So just keep that in mind, okay? Now, it might be indirect. It might be that, you know, they're going to take a role in the authorship of the manuscript or whatever it might be. But keep that in mind. Here's budget building tips. Use Excel. Use a spreadsheet to ensure everything adds up and that you don't do the transposition that I always do with numbers. Okay. Calculate the time and hours for yourself and all others. People don't, in Canada, they don't pay a huge amount of time this, but they're also looking to see that it looks reasonable. When you're calculating costs, err on the side of generosity. The granting agency will likely trim your budget, so you want to make sure you have some wiggle room in your budget in case you forgot something, in case costs go up, like transportation costs now because of the gas. Be aware and include relevant taxes. So some institutions have a thing where they don't pay as much GST, or they get money back. You should know that. You shouldn't be putting in full HST on items or GST and PST if your institution gets that money back. Okay, it's a minor detail, but it just shows that you know what you're doing when it comes to costs in your institution. Ask the research office to review your budget. They'll look at your time. They've been brilliant with me. They're like, oh, you forgot to add this in, or you don't have to pay that much for that. So they're incredibly, incredibly helpful for things like that. But don't ask them the day before your grant's due. They're not going to help you. You need to ask them well in advance. So I'm going to give you an example of budgets done in Excel spreadsheets related to that same project. So so you see here, there's staff and trainees. So that's your personnel, services, travel, publication. You see the different things I put in here. You notice there's no open access fee for the first year because I didn't have, you know, that's when you're getting up and ramped up. And I increased it to like more articles and later, 1 article per year. So think about what's reasonable there. I have circled something, a $25,000 item here, which is, this was for, it was a form of a focus group. I put that here because I want to show you something. This is sort of big bucket expenses, right? You don't see a lot of detail. You don't know how many graduate students I'm talking about, how many, like, I said 5 hours a week, but I haven't told you how much I pay that person or why or anything like that. So this is sort of big bucket items for your budget, and CIHR has gone with big bucket item budgets, which is great, and you'll get there, but you shouldn't start there. You should start with a really detailed budget. This is a detailed budget of that $25,000. I've got the number of participants, my catering costs, Oops, I've got transportation for people in town, out of town, room rental because I'd need a different room from what was available in my institute, printing of materials, how much the data analyst was going to cost me, translation. Oh, yes. Translation of materials between French and English properly done. I don't care if you're bilingual, you will still need help with this. And preparation, dissemination of reports. You could have knowledge translation activities in here. So this is a difference between a sort of a big bucket item budget and a detailed. This is the level that your budget that you use to get to the bigger items should be at. And it then makes writing your budget justification super easy. So a few notes about budgets. You need to know what the restrictions are for your institution and the granting agency. There's a lot of requests for applications that come out that don't allow for equipment. So you need to know if that's the case or not. There are differences between project grants and career awards, where there might be startup funds that you need to budget for versus project funds. There's a difference between programmatic grants and project grants. And then of course, there's the fun thing that CIHR is taking to doing, which is grant applications that have matching funding, which is, I think, a terrible practice because we're not business people, but so you need to look at that. And if they have partnership or if they have matching fundings, you need to have partnership and funding agreements in place. And you need to be super transparent about your budget with your collaborators. So you need to work out a detailed justified budget that matches your timeline. Do this by every 3 months or a year. I do like the finer the detail, the less likely you are to forget something. You can always sum up, right? You can always summarize categories or years. So use a detailed budget to complete the forms that only have a few large items. Because even though, so say CIHR has a budget where it's like personnel, trainees, service, materials, equipment, 5 things. They want the annual amount for each. The justification should break those down into your more detailed budget. Like I need 75,000 for trainees because that's going to be 3 master's students working on XYZ. Okay. Have the research office review your budget so that you don't get kicked out of the competition for doing something you shouldn't do. You need to justify each expense in detail. Don't leave any mystery as to why. And if one item looks really large, you need to spend more time justifying it. And know your reporting requirements. There's both financial and scientific reporting requirements with every single agency. You should know what those are. So that is it. I'm going to stop sharing my screen and take questions on budgets.
Gillian, thank you very much. I think you've given some real sage advice, regardless of whether you're applying for tens of thousands of dollars or hundreds of thousands of dollars or even more. I think, all these principles certainly apply. So thanks. That was very thorough and very valuable information indeed. So I'm going to open the floor for questions. I've been taking notes. I've got lots of questions for you, but let's start. Does anybody else have any comments or questions that they want to share with Gillian? Sylvie.
Go ahead, Sylvie.
Is it common practice or acceptable practice to include in the grant application costs that have already been incurred in order to submit that grant? So for example, RA time, to start REB ahead of time, write the grant, gather the lit review for the grant writing. Can you include those hours in the grant that is being submitted?
No, you can't. But that's why we all try and have RAs. That's why we try and be generous in our budgets, so that when they're working on one project, you have them helping with the next project. And it's also why with new faculty, new research faculty, startup packages are very important, because that is what the startup package is intended to help with. The REB, the preparation, the data collection, the pilot data collection. No, I think this is a very strange situation, especially with the emphasis on partnered research. That takes time and effort and expenses, and that's not paid for. Okay. So this is where, if you were going to be really strategic as an institution and you really wanted to ramp up your research efforts, because keep in mind, you then benefit from the indirects and how those get allocated, you would have seed funding to help support those activities. Seed funding and startup packages. And unfortunately, new investigators don't often realize this. So they're like, oh, we're going to give you a startup package for, you know, 20,000, which is, I'm like, but what I counsel people starting their research career is present to the institution, like, I would like to fund an RA at 0.25 FTE to help with X, Y, and Z. And I want to attend, I want to have pilot data collection. It's going to cost me this much. And I want to attend these conferences to like start getting collaborators and do this. So instead of saying like, I want to, you know, 50,000 a year, I want 100 a year, you say, this is how much this will cost me to ensure that by year 2 of my career, I've successfully submitted a federally funded grant. Yeah, but no, unfortunately you can't. Now, some of us get creative with our budgeting, but that's all I'm going to say on a recorded session.
Thank you.
It is a problem. It's, people don't anticipate that. And it's really important. It's a big effort. And by the way, I wanted to point out with what Doug said about like, you need to do this, whether it's 10,000 or whatever. There's a saying that, you know, the smaller the stakes, the more vicious the fighting. Smaller funding agencies I find are far more draconian in their requirements. I'm like, you want me to do what for $20,000? Are you kidding? So just pay attention to that and do a little like ROI calculation in your head for the amount of effort to get that small pot of money. Sometimes you don't have a choice. That's what you do to get off the ground. But like, are you going to be able to do the project? Are you going to be able to do it successfully in time? And what are they asking for you? Yeah.
Yeah, just to comment on this, often our clinicians won't have startup funds for this. I think this is part of what Sylvie was asking. So often our office will give some assistance in that initial piece for REBs, for example, for REB support.
Yeah. Well, and that's where you need to have institutional support, right? This is where you have to decide, are we an institution, a department, or whatever it might be that wants to support research. So I just restructured the biostatistics unit at the School of Care. This is not a fee for service. This is infrastructure support. And you're going to take some of that indirect money, set it aside, and there's statisticians, because they brought up, it was the preparation of the grant, the sample size calculation, the stats analysis section, even if they were named on the grant, would support off the grant, all the pilot data analysis, all those things, they had no funds to support that before they get the grant, right? And then when you get the grant, the money's actually meant to do the data analysis of the data collected in the grant, not all this pre-stuff that takes time and money. You have to think about what money is available to support people through the research process.
Thanks. Gillian, just wanted to get your thoughts on, and you alluded to this in the presentation when you mentioned rising gas prices for travel, but just inflation in general, and also supply issues, and how you get around that. Because sometimes, you know, we'll need equipment, but there may be delays in getting supply, or yeah, you know, how do we allow for this, like travel? I mean, we know what it is now, but what's it going to be like in 6 months? How do we treat these unknowns?
So you for sure in your should include cost of living increases. Usually they're published that year. So you just ensure that you're adding that in every year for personnel and different. You can even, you tend to need quotes for large items. For other items, I tend to, I'll say a 10% increase in price by year 3. And you can put that in. You can say 2 years ago it cost this, so I'm anticipating that in 2 years it will cost this, right? So definitely put that in. Almost all granting agencies offer some no cost extension. Things get delayed, or things say, I still have money and I need another year to complete of these reasons. The pandemic presented a really interesting challenge to grants because sort of all the data collection just stopped. Sylvie, can everybody else hear me? Sylvie's having audio. Sylvie,
and I'm muted. You're it's like your microphone is just cutting in and out a bit, so we're catching pieces.
Hang on, can you hear me now?
That's much better. Yeah.
I'm so glad I paid so much money for those AirPods. Okay, so which I did do on a grant. So yeah, this is what I say, be generous in your budget, right? Build in cost of living increases, build in inflation. It's super hard to plan for disaster. And what happened in the pandemic is you had to keep paying your people, but you couldn't do any data collection. And it took a while for CIHR to figure out that was happening, right? Now, there are other things that you could just, CIHR allowed the flexibility to modify. So our IRB was like, if you need to modify your protocol because of virtual, it was a 1-page thing, super fast, super easy. And I did that for a few projects. Not all projects were able to do that, but that's where, that's sort of the idea that this is the battle plan and it doesn't survive beyond the first encounter. You have to think about, there's a lot of people that like, okay, I can't continue this project as is. What can those people do? They can do systematic reviews. They can do narrative reviews. They can do key informant interviews on implementation piece of what you're doing. So this is where it has to be creative and where you actually need to have a conversation with a funding agency or you're offered to sponsored research. Yeah, I don't think anybody could have anticipated the inflation rates. However, the funding agencies are aware of them. And then you've got what you then have to do is say, we couldn't do the full 3 years because of these inflation. We did 2 years. So you have to be you have to be thinking about this, but it's also where you need to be aware of where do you have flex in your budget. Okay, where I always add trainings in, because if everything goes to, I can do the work, right? I can absorb the time and the work and use the money allocated for training for, the fact that my other expenses quadrupled and I didn't expect it. So this is where it's good to sort of build in that flexibility with the knowledge of, well, this is what I'm hoping to do. What if something goes wrong? And actually, I just listened to a talk this morning about planning for disaster. Somebody was talking about the fact that, you know what, we're not like between the climate, as you know today, between the climate and the pandemic and God knows what else, like we're not going back to a normal. So how do you plan and anticipate and become resilient for those things? And so you just need to be thinking, I mean, we're researchers, so we're inherently creative because we're trying to imagine solutions that haven't been found yet. So sometimes you have to be a little bit that way about your project and keep your eye on what is the most important thing to achieve. So where, if you need to, one of the things in the US grants I think are really a good ideas, I'd like to see more, and they are, you tend to see it a little bit in CIHR. What are your challenges? And what are you going to do to overcome them? So what are the things? And often challenges are around recruitment. So if you have a challenge on the recruitment, so if you can't get all your subjects, what are you going to do? You know, what's your backup plan? So I think about when you're doing your budget, think about the challenges to your project. What are the overt threats? And what would you do if that came true? And have you got the money there to deal with that? It's fun, isn't it? I'm going to try and answer a question that's never been answered and hope that I got all the expenses right.
Any other comments, questions, folks?
I was just going to ask, so I'm not experienced at all. I'm a clinician, and Sylvia and Doug know me. I got a sort of grant from the Department of Family Medicine to build an app with the University of Ottawa Engineering, and they have an NSERC grant. Their NSERC grant is coming to an end. But anyway, they've said they'd sustain me until 2023. But I guess one of the things is, I'm just wondering if you can speak a bit about stakeholders and, you know, like focus groups and things like that. I mean, again, I'm very basic and I don't want to take up too much time if other people have, you know, more evolved questions, but
No, it's quite all right, Cleo. Yeah.
Yeah, so I mean, I would like to test the app, you know, maybe adapt it to different groups, you know, so it's a preventive care app, but, you know, there's a lot of vulnerable people. And for instance, we have a transgender, that's the first vulnerable or marginalized group, I should say. So testing it. So what have you encountered as costs? And I know you put a bit of detail there, like their travel, their meals, but maybe if you can speak a bit to that. We can't hear you.
I'm surprised. Yeah, and we have done that. You are on mute. We got that bingo card. Okay. So Cleo, that's where actually talking to a patient who's your target for that, right? So if you have a transgender patient you have a good relationship with, you can actually have a conversation. Listen, I just want to take 10 minutes of your time. I mean, if you were to participate in this research, what would it cost you? Why would you want to participate? What should I do to make it like that that would make it less of a burden on you? And you know, so when I was developing a role-playing game to collect health-related quality of life data in a situation where it's a social taboo situation, I needed to test this in young teenagers. They're like, pizza? Yep, I'm there. You make it after school and pizza and on a bus line, someplace where we can get to by metro, we're there. I'm like, that's a deal. You just tell me what you want on your pizza. Yeah. So it really, and this is one thing where it's always good because there's a lot of people say, well, you should just pay patients. Well, there's some people that don't want to be paid. They don't want their pension messed with by getting extra income, right? Mm. They want to, so for example, I did research work with parents of children whose children had died of brain cancer. And I thought, oh man, this is gonna be awful and I'm never gonna get them and they're not gonna want to talk about this. Turns out, these are people that, because the death of a child is taboo in our society, they were thrilled to come and participate in my research because I wanted to hear about something nobody else wanted to listen to anymore. And for them, the death was never going away. It was such an integral part of who they were and what they were and their life. And I wanted to hear about it. And so they were there, they were fully present. They would do anything because I was giving them something they needed. So you don't want to take advantage and you don't want to coerce people, but you need to think, okay, what does this do for them? And a lot of people really do like feeling like they make a difference, but you also don't want to make it onerous on them. So your best bet when you want to do something like that is talk to the people, talk to somebody who would be somebody you would invite to that. And they're going to enjoy being your expert. You know, they're going to use like, if hypothetically, if there's this research project, would you participate in it? And if they're like, no, say, oh, how come? Or yeah, and it's like, oh, what would make it easier? What would you like to do? What would you like to have happen when that's the case? They'll tell you. They're happy to share. You're going to learn some unexpected and unusual things. Yeah. So that's for me, that's the best way to figure things out. You know, I worked with Inuit communities, and I mean, they were really frank with me. As long as they sense you're actually listening, like you actually want to know, and you're coming from a place where you're being humble and saying, listen, I really just value your experience and expertise. And that you're then willing to act like you're willing to take that into account and work on it. Mm-hmm. So it's really interesting how many researchers are super uncomfortable doing that. And then they run into all the recruitment issues. Like, oh, why that happened?
And did you find, so I think you spoke, again, I'm not too familiar with the structure when you apply for a grant, but you spoke about having a patient in your group. Mm-hmm. So is that patient like in the sort of steering research group? And then there's the people, you know, that you do a focus group or something. So again, maybe this
in both situations, I have people that have been compensated and people that haven't.
Okay. Yeah. That's clear. Yeah.
So for the participation in the focus groups, it tends to be expenses, compensation for expenses. So if it tend to be parking, taxi, I'd provide food. So for the consultation, some of my patient partners really appreciate it. It's typically $25 an hour to be compensated for the time they donated to that, because that's not their job, right? As researchers, it's our job. We get paid to do this stuff. So it wasn't, so they appreciated that. Some of them are like, no, I don't want to, I would rather that if I want an article, you'll get it for me from the library, or, you know, it just depends. Like my mom is actually a patient partner for a lot of people, and my unpaid RA, she does all my proofreading, everything. She's done patient reviews for Doug's mock peer review committees. Yep. Loves doing it, does not want to be paid. Just loves doing it. Just loves hearing about new ideas, loves talking to especially new researchers. She just, she loves it. So that doesn't mean she doesn't charge me, but in other ways. Yeah. But you know, she just loves doing that stuff. So you really have to, it's one of those things, there's no hard and fast rule. Plan conservatively, plan that you'll have to pay everybody for everything. And then if you don't, great, but that's giving the people the autonomy to make those decisions, not you making the decisions.
That's very helpful. That's very practical. Thank you.
Yeah, if you're not sure about something, find somebody who's had experience with it or who will know. There's a lot of resources, a lot of people that have found things out the hard way, and they're very happy to share so that you don't have to go down that path.
And as you say, you have to be diplomatic, you know, too, when you're dealing with the, you know, groups of people who have been marginalized. You have to be very respectful, and so anyway, navigating that is a whole issue too.
Yeah, I think people have an inherent ability to sense sincerity and transparency. So they absolutely also have a sense of when you have an agenda. So you really need to go there saying, hey, I'm an expert in this area. I am absolutely not an expert in this area, and that's where you are an expert, and I really want to learn from you. And you really, that is the approach you've got to take. Still not going to always work. There's certain projects you probably should not be doing because of institutional racism, because of years of abuse and mistrust. So unfortunately, even though you might be super bright and really committed and passionate, maybe you shouldn't be doing that project.
Great. Okay, thank you. That's
But
good.
you can create space for a young person or a new investigator who should be doing that project and partner with them and mentor them and support them and make sure it happens that way.
Yeah. Good.
Yeah. Oh, that's great discussion. For everybody, is there anything that Gillian did not cover that you were kind of hoping she would? Anything at all? Feel free
Go
to ask.
ahead.
Hi,
Yeah, go ahead, Anita.
that was great. I'm interested in what you said about generously planning the budget. And I'm thinking about, you know, the internal funds, the running ones, the, you know, cyclical one, when you don't spend all the money because you were very generous with the initial fund. How do you mitigate for this so that, you know, you'll get the grant the next year or the year before?
Okay, so I have never, ever in my career sent money back. Okay, so I'm probably your expert on this. So remember Sylvie said, oh, can you like plan things that are already spent? Track your money. Look at how much is getting spent versus what you still have to spend versus the timeline. If it looks like you're going to hit the end of the thing and you're going to have this big pot of money, and funders do not like that when you do that, then there's things you need to think about. So is there an extra article I can produce? Can I go for an open access publication versus another type of publication? Did this generate some pilot results that can be used to produce another protocol? Can I hire an RA to speed up the data analysis? Can I take on a student and pay them a stipend or a scholarship to maybe dig into a sideline on your project? There are any numbers of things. The thing I recommend that you spend this on is personnel. Get people in to help you. As clinicians, as new investigators, we tend to be terrible at delegating. So we tend to want to do it all ourselves. Not always a fabulous use of your time. So you could even, if you look like you've got money left, consult with a biostatistician. They're not cheap. Talk to have them work on your data or on different things that is beyond your scope to help you produce an extra article, a methods piece, whatever it might be. There's always ways. So, but what you need to do is look at how your spending's going versus what you still need to spend, and make sure you're not doing that at the last minute.
Thank you.
Yeah, pay attention to your money. That's where your Gantt chart is super helpful. Like, what's happening? Have I spent it all? And you can always ask for a no cost extension, but that won't go beyond 1 year. And you can't blame your institute if you haven't spent all your money for not wanting to give you more money.
Good advice. Any other questions? Well, if not, Gillian, thank you so much for this session. It's
Sure.
been super valuable, honestly. And as I said, this will be posted so that people can listen into it, and they can always ask us questions afterwards. So thanks again. And thanks to everybody that attended today. And please stay tuned for our June session, which will be the last one in this series. So much appreciated. And I wish you all a good night.
Thanks, everybody. Have a lovely evening.